us about understanding Medicaid buy-in and waiver programs. A complicated topic we could all use some more information about. And I think we're good. Erin, you go right ahead.
Okay, excellent. All right, just gonna let a couple more people in real fast. All right. So did you know, according to a 2020 study by Autism and Developmental Disabilities Monitoring, 1 in 76 8-year-old children in Colorado, or 1.3%, had been diagnosed with autism spectrum disorder. And 48% of children identified with ASD received a comprehensive developmental evaluation by age 3. And based on IQ testing, 32% of those children identified with ASD were considered to have an intellectual disability. So let's talk about getting some help. So your child might need occupational therapy, they might need speech, behavioral therapy, or a mix of things. So you may find that your primary insurance covers some things, but others are out of pocket. And always make sure to clarify your coverages with your insurance company. Oftentimes when I'm working with clients, they're like, hey, I really want to get ABA therapy. And then they go through all the hassle of finding somebody that they really like and connect with. And then they find out that their insurance doesn't cover it. So definitely you want to clarify your insurance coverage before you get going on everything. And getting help for your child can be a strain on family finances. So it is important to know about and take advantage of support programs available through the state. So my goal for you today is that you will leave with a basic overview of some of the financial support programs available in Colorado. You'll have information about eligibility and possible benefits available through various Medicaid and Medicare programs. You'll have information about eligibility and possible benefits available through different waiver programs. And you'll get some tips and advice that come from real life experience. So let's talk about Medicaid and CHP Plus. So I'm first going to give you a little history lesson here. On July 30th, 1965, President Lyndon B. Johnson signed into law the bill that led to Medicare and Medicaid. Over the years, Congress has made changes to Medicare and Medicaid. And in 1972, the program was expanded to include people with disabilities. Though Medicare and Medicaid started as basic insurance programs for Americans who didn't have health insurance, they've changed over the years to provide more Americans with access to the quality and affordable health care they need. So here in Colorado, we have Health First Colorado. Medicare and Medicaid are federal programs, but they are managed and their funds distributed by individual states. And in Colorado, the group that manages the program is the Department of Healthcare Policy and Financing, also called Health First Colorado. Its mission is to improve healthcare equity, access, and outcomes for the people it serves while saving Coloradans money on healthcare and driving value for Colorado. So Colorado's Medicaid program is a public health assistance program for Coloradans who qualify. And those who qualify are children, pregnant women, parents and caretakers, people with developmental, intellectual, and physical disabilities, and adults can all potentially qualify. Every Health First Colorado member is assigned a primary care provider, and members and primary care providers belong to a regional organization that helps make sure Health First Colorado members get the healthcare and services they need. Regional organizations can also help members understand and manage physical and behavioral health benefits, find specialists or other providers, and connect members with transportation, food assistance, or other social services if needed. And just a little note here, when you apply for Health First Colorado, you are applying for both Health First Colorado and Child Health Plan Plus, which is CHP Plus. So you and your primary care provider belong to a regional organization that helps you make sure you get the healthcare and services you need. So your regional organization can also help you understand and manage your physical and behavioral health benefits, help connect you to providers, and connect you with the resources for needs such as transportation, food assistance, and other social services. And your regional organization is listed on your enrollment letter that you receive from Health First Colorado when you first get enrolled. So all of that information should be in that letter. So some of the regional organizations that I'm talking about are Colorado Access, that serves like Adams, Arapahoe, Denver, Douglas, and Elbert counties. Then there's Colorado Community Health Alliance. That's going to serve your Boulder, your Broomfield, your Clear Creek, El Paso, etc. And then your Health Colorado Inc., which that serves your Alamosa, Bench, all of those, Pueblo, all of those lower districts. Then you're going to have your Northeast Health Partners. That's going to serve your Cheyenne, your Kit Carson, your Lincoln, et cetera, et cetera. And then you've got your Rocky Mountain Health Plans. And then Denver Health Medicaid Choice, which serves primarily Denver, Jefferson, Arapahoe, and Adams counties. So you can see that there's lots of regional organizations that you can work with. So the big question is who qualifies for Health First Colorado? So children's ages 0 to 18 whose household income does not exceed 142% of the federal poverty level can qualify. So for a family of 4, the federal poverty level in 2022 is $27,750 per year. So 142% of that is $39,405. Pregnant women whose household income does not exceed 195% of that the federal poverty level. Also parents and caretaker relatives whose household income does not exceed 133% of that level, and adults without dependent children whose household income does not exceed 133%. Eligibility requirements can be complex, so make sure that you talk to a program administrator, get some program information. Anybody that can help you over at Peak is going to be really good at helping you understand if you qualify or not. It's very confusing, guys. I understand that. So let's talk about Medicaid buy-in. So the Health First Colorado buy-in program for children with disabilities lets families of children with a disability who qualify to buy into Colorado's Medicaid program for that child. Applications are handled by Colorado Peak. You'll notice quite a few things are handled through Peak. If your child qualifies, you may pay a monthly premium to be in the program, and the premium is based on the family's income. So not off of your child's income, but off of the family's income. So who qualifies for Medicaid buy-in? So you must be a child under the age of 19. You must have a qualifying disability. The Social Security Administration listings describe what disabilities do qualify, and ASD is a qualifying disability. Your gross family income after disregards must be below 300% of the federal poverty level. A disregard is a portion of income that is not taken into account through means testing. So for example, in 2021, a family of 4 earning about $10,128 a month before taxes may qualify. Again, I want to specify may qualify. I've had clients come to me that make more than that who have qualified, and I've had clients come to me who make less than that who have not qualified. So it really depends, and it all kind of depends on who you're talking to that day, and what is necessary for you to qualify. So big emphasis on the may. Applicants should always complete the Health First Colorado application to find out if their income qualifies. So even if you're sure, you're like, I really don't think I'm going to qualify, it's worth just filling out the application. It doesn't take that long, and it's just worth it. You never know. You are not required to apply for SSA disability, but you must fill out the Health First Colorado disability application and medical release form on the How to Apply page. They will also determine if you qualify using the Social Security Administration listings without regard to your child's substantial gainful activity or ability to work. So if your child is enrolled in the Children's Buy-In program, they will receive full Health First Colorado benefits. And those benefits include doctor's visits, prescriptions, mental health services, dental, lab work, and x-rays. So you kind of get the whole gamut there. So next, we're going to talk about CHIP and CHP Plus, and we're going to talk a little bit about the history as well. So the Children's Health Insurance Program, otherwise known as CHIP, was signed into law in 1997 by President Clinton and provides federal matching funds to states to provide health coverage to children and families with incomes too high to qualify for Medicaid, but who can't afford private coverage. All states have expanded children's coverage significantly through their CHIP programs, with nearly every state providing coverage for children up to at least 200% of the federal poverty level. And in 1998, Colorado was one of the first states to pursue CHIP, creating its own separate programs called CHP Plus. Policymakers reasoned that a separate program could build on efforts pursued in Colorado in the mid-1990s to create a children's health insurance program. So we were definitely an early adopter of this new CHIP. So if your child doesn't qualify for Medicaid, there might be a possibility he or she is eligible for coverage under Children's Health Plan Plus. This is Colorado's version of CHIP, like I mentioned, which is the federal's Children's Health Insurance Plan. CHP Plus is a public low-cost health insurance for certain children and pregnant women. It is for people who earn too much to qualify for Medicaid, but not enough to pay for private health insurance. The program is managed by the state of Colorado, and applications go through Colorado Peak. The coverage is very similar to Medicaid. So this is kind of a breakdown of the eligibility based on household size. So you can see what the maximum income level is for a family of four is $66,250. So if you're right at that or below it, you could qualify for CHP Plus. So now we're going to talk about health insurance buy-in, which is also referred to as HIBI. So HIBI is a premium assistance program for Health First Colorado members. It sends monthly payments to you for all or a portion of the cost of your commercial health insurance premiums, and in some cases also reimburses you for deductibles, co-insurance, and co-payments. The health insurance buy-in program pays a Health First Colorado member's portion of a commercial health insurance premiums when it is cost effective to do so. HIBI has saved an accumulated net total of approximately 51 million Health First Colorado dollars since the program began in 92. So for example, my son gets HIBI, and since we have private insurance, we get a check every single month that covers his portion of our private insurance. It's less expensive for the state and it's beneficial to us as a family. So it's a nice little extra benefit. So who qualifies for HIBI? You must qualify for Health First Colorado and have access to commercial health insurance. So qualifying for HIBI does not affect your Health First Colorado eligibility. Federal law requires employers to allow you to enroll in their group insurance within 60 days of when you are found eligible for HIBI, even if this occurs outside of your employer's usual open enrollment period. So for example, if you just got a new job and they say you're not going to be eligible for benefits until 90 days after you start, by law, they have to give you HIBI 60 days after you start. So it's nice if you have one of those situations. The annual cost of your commercial health insurance must be less than the estimated total cost of your annual medical expenses, out-of-pocket cost, and administrative cost, which that shouldn't be too complicated. You have a high-cost medical condition and still can be considered for this program. And you do not need to have a catastrophic illness to be considered for this program. So what are some of the benefits of HIBI? Well, first, like I said, you can get a monthly payment for a portion of the cost of your commercial health insurance premiums, which who doesn't like to have a little extra payment each month? Benefits from both the HIBI program and Health First Colorado, you can get them at the same time. You may also receive reimbursements for co-payments made toward deductibles, co-insurance and co-payments if you are visiting a provider within your health insurance network. And in some cases, you'll get COBRA continuation health insurance that's offered for 18 to 36 months if you are a recently terminated employee. So for more information, definitely talk to your benefits coordinator about that. And you can apply directly at mycohibi.com. and who I like to say HIBby too. It's kind of a fun little word too. All right, so let's talk about waivers. I'm sure most of you on this call have heard of the waivers. Maybe your child is enrolled in the waivers, or you're trying to get enrolled, whatever it may be. Waivers are a big thing here in the state of Colorado. So another way for families to get additional support for their children with disabilities is through a number of children's waiver programs offered by the state. There are adult waivers as well, but for today, I'm just going to concentrate on the children's waivers. The requirements for eligibility for each program varies, as does the type of support each one offers. These programs can help families with supplies, adaptive tools, sensory items, respite care, and other things. And applicants may apply for more than one waiver, but you may only receive services through one waiver at a time. So you may qualify for multiple waivers, but you can only get services through one. There has definitely been some confusion with that in the past. So the first one I'm going to talk to you about is the children's HCBS waiver. And HCBS stands for Home and Community-Based Services. The intent of this waiver is to provide Health First Colorado benefits in the home or community for disabled children who would otherwise be eligible for Health First Colorado due to excess parental income and or resources. So if you're above that level, then you won't qualify for the other options, but you might qualify for this one. Applicants for this waiver go through your county department or Human and Social Services, single point entry, or community center boards, often referred to as CCBs, and private case management agencies. So how are you eligible? Well, the child must be aged birth through 17 years old and must be disabled to the point of being at risk of being placed in a nursing facility or hospital. And I want to clarify something. When people hear that, they often be like, oh, my kid's not going to qualify because they don't need to go into a nursing facility or a hospital. Those are just words, to be totally honest. Don't pay too much attention to that. You definitely, if you feel like your kid is disabled and they need some extra help, you may qualify for this one. So don't pay too much attention to the nursing facility or hospital. They're not going to send your child into one of those. This waiver is intended is intended for those children who require a very high level of care. The waiver includes case management, in-home support services, and health maintenance. And it's administered by the Colorado Department of Healthcare Policy and Financing. And you can go to the Colorado HCPF website for more information on that. Now, I'm going to talk about the CES waiver, and a lot of parents have heard of this one, and this is honestly the most common one that I see my clients get on is the CES waiver. This is a pretty popular one. So the CES waiver stands for Children's Extensive Support. And this program exists to provide Health First Colorado benefits in the home or community for children with developmental disabilities or delays that are most in need due to the severity of their disability. So to be eligible, children must meet a series of targeted criteria. And again, it's up to your case manager, the CCB, to decide if you're eligible or not. But one hiccup I have heard from multiple clients of mine is that they aren't eligible because their child sleeps through the night. That is one thing that is a requirement. Your child cannot sleep through the night on their own. So for example, my son is on the CES waiver. And when they ask, like, hey, does he sleep through the night? And I remember saying, like, well, he only does if we're literally laying next to him. And they asked, well, what would happen if you weren't laying next to him all night long? Be like, well, he'd be up every 45 minutes, every hour, they're like, okay, yeah. So then he definitely needs significant help throughout the night. So that is one thing with the CES waiver that kind of gets people stuck on that one. Applications and case management are handled by your CCB. So definitely pay attention to where that is.
Do you mind if I say one thing too for that, the sleeping through the night piece?
Please.
They also now will make sure it's not just like if they're up through the night, they have to be up and kind of in some kind of a dangerous situation. Like if they are too little and they're going to go down the stairs, or if there's somebody who tries to get out. We have some that like are teenagers that will get up and do things that are scary or dangerous. So if they feel like they just wake up and watch a game and they're fine and safe, they won't qualify, but they'll make sure they have to be kind of at risk during that time.
Yes, thank you for clarifying that. Absolutely. So exactly, we don't want any elopement. So if your child is going to run out of the house in the middle of the night, there's those kids that can, undo all the locks and get out of the house. Like she mentioned, falling down the stairs, anything of that is of concern. They want to make sure to know that. And those are the kiddos that they're going to be able to help. So to be eligible for the CES waiver, children must be ages birth through 17. They must have an intensive behavioral or medical needs and be at risk of institutionalization. Again, I use institutionalization lightly because I don't want you to think like, oh my gosh, if we get our kid on this, we're going to have to send them to an institution. That's not it at all. That's just trying to emphasize the severity of what they're looking for. Children's ages birth through 4 must have a developmental delay, and children's ages 5 through 17 must have a developmental disability. So for example, my son at 4 was put on the CES waiver. And then at 5, his Vineland scores were too high, so he doesn't qualify for the CES waiver anymore. So you can get on early on, and then as your child gets older, at the age of 5, they're going to ask for those test scores again and see if your kid's going to qualify. And if their scores are too high, then they can be taken off of that waiver. For a child to qualify as having a developmental disability rather than delay, testing such as like I mentioned, the Vineland assessment is required. And there's a couple of other tests, but the Vineland is a big one. So what are some of the benefits? Why do I want to go through all of this questioning to get this? Well, you can get adapted therapeutic recreation and fees covered. You can get some assistive technology and you can get some sensory items. So as you can see in this picture, we've got a little kiddo with a sandbox there. That's something that they can cover. Usually you have to get an OT or a PT, an occupational therapist or a physical therapist or speech therapist to recommend this. You can't just go through Amazon and be like, this looks like fun. There has to be a real medical reason as to why you need those sensory items, but you can get fidget spinners, trampolines, if your kid needs to jump, any of those sensory seeking toys, you can get covered. You can also get home accessibility adaptations. You can get homemaker support, cleaning services, things of that sort. And you can even get parental education services. So for example, if you want to read up on autism, you can say, hey, I want to go get this book, and they will cover the cost of it. They also do some parent training that you can either do in person or via video, and they will cover the cost for some of those. You can also get professional services, including hippotherapy, massage and movement therapy, water safety courses, etc. You can get respite care. And I say you can possibly get respite care. That's definitely an area that's hard to get these days. Every county is struggling with that, but that would be covered if you are able to get it. And that's just a professional childcare support so parents can get a much needed break. So sometimes you can get respite like for once a week. So you can come in, maybe have a date night, or you can go to the grocery store with not having to have littles all over you all the time. It's just extra help that parents can get. You can also get specialized medical equipment and supplies, and you can get vehicle adaptations if needed. The CES waiver is there to help children and families by providing services and supports that will help children establish a long-term foundation for community inclusion as they grow into adulthood. And the program is administered by the Colorado Department of Healthcare Policy and Financing, and the case management is provided by your local CCBs. And again, you can get more information at the HCPF site. The next one I'm going to cover is the HCBS CHRP, or often CHIRP waiver. HCBS stands for Home and Community-Based Services, and CHIRP stands for Children's Habilitation Residential Program Waiver. And this program provides Health First Colorado benefits in the home or community for children and youth who have an intellectual or developmental disability and extraordinary needs. Case management is handled by your CCBs here as well. So to be eligible, you must be ages birth through 20 years old. You must have an intellectual or developmental disability and intensive behavioral support needs that put them at risk of out-of-home placement. The child or youth must meet the intermediate care facility for individuals with intellectual disabilities definition. And that definition is a residential facility that is certified by the Centers for Medicare and Medicaid to provide habilitative, therapeutic, and specialized support services to persons with intellectual and developmental disabilities. Are you guys confused yet? This is so confusing. They're very long explanations. It's an optional Medicaid benefit that enables states to provide comprehensive and individualized healthcare and rehabilitation services to individuals to promote their functional status and independence. And residential and day support services that include active treatment. So you might get some structured behavioral and intensive physical health management to establish optimal functioning. You can get some supportive services, which is help with activities of daily living, such as grooming, laundry, help with meals, assistance, and medications. So some of the services available through the waiver include cognitive services, communication services, emergency assistance training. You can get some independent living training, personal care services, self-advocacy, supervision, and travel. So those are all things that may be included. Some other services are supported community connections, respite services, professional services such as hippotherapy, massage, and movement therapy, water safety. So some similarities to the CES waiver here. You can also get some intensive support services and transition. So transition is when your child is transitioning from child to adult. You can get some help with that. So maybe some job placement, what do you want to do after high school, things of that sort. So in summary, the CHIRP waiver provides services for children and youth who have an intellectual or developmental disability and very high needs. Their needs for support put them at risk of or in need of out-of-home placement. Waiver services help children and youth learn and maintain the skills needed to live in their communities. Children who receive the services through the CHIRP waiver are also eligible for all Health First Colorado covered services as long as they are not duplicative. And again, you can find more information at the HCPF site. And then the last waiver that I'm going to talk about is the HCBS CLLI waiver. And that stands for Home and Community-Based Services, and CLLI stands for Children with Life-Limiting Illness waiver. This program seeks to provide Health First Colorado benefits to children with a life-limiting illness. It is intended to allow the family to seek curative treatment while a child is receiving palliative or hospice care, and applications and case management is handled by your single point entry. So oftentimes you'll handle through the CCB. This is another one that's handled through your single point entry system. So am I eligible? To be eligible for this waiver, children must be ages birth through 18. They have a life-limiting illness that can be safely cared for in the home and who are at risk of being placed in a hospital or institution. There is an enrollment cap of 200 children for this program. So not everybody's going to qualify. Benefits available through the CLLI waiver include you're going to get some expressive therapy such as art and play therapy, music therapy, massage therapy to help with any pain and things of that sort. You're also going to get that palliative and supportive care such as care coordination, pain and symptom management. Again, respite care is in there. Therapeutic services such as bereavement counseling and therapeutic life-limiting illness support in an individual, family, or group setting. And services offered with this waiver supplement the services that you already receive through regular Health First Colorado benefits and other federal, state, and local public programs, as well as the support that you get from your community. So children who receive services through the CLLI waiver are also eligible for all Health First Colorado covered services except nursing facility and long-term hospital care. So they really do want this to be an at-home care situation. And then again, you can visit the HCPF site for more information. So these are just some resources that I've included that give a lot of information. Again, HCPF is kind of the main site that I recommend, but you can definitely go to Health First Colorado for the Medicaid information. You can go to Colorado Access for CHP Plus, Colorado Peak for that benefit management, and then healthcare.gov for your federal programs. So in summary, getting help for your child with a disability can feel like an overwhelming, expensive endeavor, but there are programs out there to help families like yours, no matter what your situation or income level, and find out what your child might be eligible for and apply. So definitely, even if you think, oh, my kid's never going to qualify, just take the time to apply. You never know. Every case is so different. I've honestly had clients where it's like, yeah, I don't think you're going to qualify, but still do it. And guess what? They did qualify. And I've had cases where like, oh, you'll definitely qualify for sure. And they didn't. So, don't be afraid. If you really think your kid's going to qualify, you can always ask for a different case manager and talk to somebody else, a supervisor or anything at the CCB or single point entry. So don't be afraid to ask for a second opinion in some cases. Excuse me. Make the most of the potential benefits that are out there and ask lots of questions, guys. Don't be afraid to seek help navigating all of these programs. This is a lot. It's confusing. It's overwhelming. And so don't be afraid to ask for help, talk to other parents. You're more than welcome to ask me questions. There are others out there, professionals who can help you and guide you through this a little bit. And so like every person with a disability has their own special situation and their own path to follow, and navigating programs like Medicaid, CHP Plus, and the waiver programs is hard. But the most important thing to remember is that you are not alone. Help is out there. And so that's pretty much why I started Mountain Summit Consulting, is to help families going through this process. Because when I was going through it with my son, I felt so alone and overwhelmed, and I didn't know where to go. So, let's take advantage of a free resource assessment call. It's no more than 30 minutes of your time. I'm there to support you and offer any help that I can for going through all of this. So thank you all so much for taking the time. I'm going to open it up to questions at this point.
Thank you so much for all that information.
Absolutely.
I apologize at the beginning. I kept trying to talk, but my screen here, I'm kind of like way out in the sticks and my stuff kept freezing on me. And then I'd open up another window and then I had like 3 of you talking to me. Like it was just your voice and 3 different screens I couldn't get rid of. I was like, oh no, sorry. So I'm so sorry.
No,
Yes,
not a problem. I understand.
Thank you so much for being here and doing this. This is great. So far on Facebook, we do not have any questions, so I will give it to Kirsten.
Okay, could someone commented, and I think it's worth putting out there, that you could get family CNA and pediatric personal care services. Would someone like to clarify which service or waiver those are available through? I know a couple. Erin, you might know that, or Nicolette, you might know that.
So CNA is a separate thing that is not necessarily through the waivers, that you are going to apply for that separately. So to become a certified nursing assistant, you actually have to take a course. First, you need to find an organization. So there's a lot of great ones. Pasco is an amazing one. Team Select is out there. There's a bunch of companies out there that will come to your house, do an evaluation, and see if you even qualify, if your child's going to qualify for that. If they do, then what they're going to do is they're going to send you to a school to become CNA certified. It's usually an online course these days. Sometimes I do think they have a little bit in person. Correct me anybody if I'm wrong on that. And then if you pass the test and you become certified, then they will pay you for so many hours. Every individual is different on how many hours you'll qualify for. And then they'll pay you to take care of your child. So that is not through the waivers. That's its own separate program. Yep, great question.
Yes, absolutely. Yes, I'm a parent CNA, and it is, and we have the CES waiver. So it's through my son's through his Medicaid that I get paid as his parent CNA. And then yeah, there are a few companies out there that will help. Oh, look, and it looks like somebody has put those up there. So perfect. So if you look in the chat, the names of the companies that do those parent CNA programs are also listed by an awesome parent. Thank you.
Yep, great, thank you. Yep, I know I was missing a few. But there's lots of good organizations out there so definitely, if you would like to become a CNA or you think you might qualify, definitely, again, it never hurts to have somebody come out to your house and do an evaluation. It's no charge to you. It doesn't take that long. My son did not qualify for for me to become a CNA. Autism is definitely one of those tricky ones. So it kind of just depends on the severity and what other needs your child requires.
Another question says, if I have an adult child age over 18, can she get a waiver that helps with her insurance / transitional training when she lives at home and we support her? Yeah,
so there are a few adult waivers. And I didn't go into the adult waivers because that's kind of just a whole other presentation. I didn't want you guys to have this glazed over look and completely forget everything because it's all very confusing. But yes, there are some transitioned. I can't remember everything that's covered, but the two main waivers I would recommend looking into for kiddos with autism is the DD waiver and the SLS waiver. Those are going to be the two main ones. And I do believe that transition services is covered under both of those. Don't quote me on that. I might be wrong.
Thank you. Damien says, if kids don't qualify, family CNA pediatric personal care is an option.
Yes, thank you.
That's another one.
Rosenberg is from Pasco, one of those amazing organizations. So yes, Damien would definitely know about the CNA stuff. So yeah, thank you, Damien. And the two,
yeah, go ahead.
The two waivers, that's for the SLS and the DD waiver are the two that you may qualify for when you're an adult.
Can I clarify? Sorry, Elaine with Pasco here. Pediatric personal care is not for adults. It's actually under the long-term home health. So you don't have to necessarily be on a waiver. You just have to qualify for Medicaid or CHP plus. Under the program, it allows family members who don't quite qualify for a CNA level of care, but there are still needs under activities of daily living for support within the home. It allows the parent to still be able to get a break based off of that task, and they can choose that caregiver, whether it's a sibling, grandparent, brother, or somebody else. It can't be a guardian. So it's not the personal care that we see in DD services. It's a separate program in itself. And it's meant to still not like respite either. It goes after the task. So for example, if you have a kiddo who has difficulties wanting to take a shower, and you see that need is daily and as a struggle for that parent every day for them to be able to take a shower, to where something that's 30 minutes can take up to 2 hours can be very tiresome for the parent. So, but they don't necessarily qualify for CNA because they can do the task themselves. This program under pediatric personal care allows the family member to choose somebody that they trust to provide guidance for that support and task. So undressing, bathing, providing the prompts and guidance so they don't dump a whole bottle of shampoo down the shower so they can continue to take the shower. And then also like brushing teeth, hygiene, or anything else like that. And then it's however long the task takes. So mom can go take a shower herself, and then somebody else is helping kiddo through the guidance of that task. Sorry, I just wanted to clarify. It's a great program. It's just not well known.
Yeah, thank you for clarifying. That's awesome.
Someone's asking, can you please repeat the two waivers for ASD?
The adult waivers or the children?
I think it's pediatric.
So there's a couple. I mean, the CES waiver is the most common that you're going to most families will get, but you can also do the HCBS CHIRP waiver as well.
Someone's asking about permanent residents youth. Are they able to apply for Medicaid? Do we know that?
Don't know that answer. Does anybody else know that answer? I don't know, and I don't want to give you the wrong information.
What was the question?
The question is, can a permanent resident youth apply for Medicaid?
A permanent resident
Yes.
to Colorado?
Don't know.
I mean, these are Colorado programs, the ones that we're discussing. So if anybody is a resident of Colorado, the waivers and the Medicaid programs that we have been discussing are all, you need to be a Colorado member or live here in Colorado. If that answers it.
Another question is, can my son qualify for a CES waiver if we have private insurance, but they do not cover ABA? That should be covered in Colorado.
So there was a law passed that private insurances should cover ABA. So I would definitely talk to your insurance agent. There is kind of a workaround with some private insurances, some smaller insurances. So it depends on who you have. But yes, you can still qualify for the CES waiver even if you have private insurance. So what would happen is through the CES waiver, you would get Medicaid as a secondary insurance. And so anything that your private insurance doesn't cover, Medicaid as your secondary insurance would. So for example, like my son Henry, when we had the CES waiver, we have Blue Cross Blue Shield as our primary, and then the CES waiver was our secondary. And it would cover his copays and deductibles and things of that sort. So kind of anything that our private insurance did not cover. Yeah, great question.
And then I have a question from Facebook from Kristen. She said that they are new to the Medicaid buy-in program with a 6-year-old. Is this something that they'll have to qualify for each year?
Oh, that is a good question. I don't know the answer to that, to be totally honest. I've never gotten that question before. I don't know. Does anybody else on this call know if they have to qualify every year? Because I know it's based on income, so it would make sense if they do. Sorry, that's a great question. I can definitely look into that.
It is a great question. We will look into that and get back with you.
Yeah.
Someone saying, looking at DD and SLS, who do we speak to about that?
Yeah, so that would be through your community center board. Correct me if I'm wrong. I don't, hold on a second. Hold on one second. I don't want to give you the wrong information there. So the HCPF site definitely has all of, has great charts for people to take a look at if you kind of want to know what's covered. Let's see here.
Erin, this is Damien. I would think community center board would be the best if you have a case manager, just to figure out what's right for you, right? And the community center boards, wherever you are, if you're in Jeffco, it's going to be DDRC. If you're in Arapahoe, Douglas, it's DP. I mean, I don't know. I don't know if you need to know all those, but you should talk to your case manager because they both have pluses and minuses. But the only thing about DD is there's a wait list unless you're on the CES waiver. So you can't just hop on the DD if you're not on the CES. If you're starting as an adult, kind of getting onto that, there might be a couple year wait. But after the CES, it's pretty swift transition. Douglas County, you should be in DP, Developmental Pathways catchment area.
Yep. Thanks, Damien. Appreciate that.
Yep.
Yeah, I was just confirming. I just didn't want to tell you guys to case go to CCBU and it's a single point entry, but both of those are CCBs. So yep. Thanks, Damien.
Yes. Thank you. And then the Medicaid buy-in, it works like the Medicaid program. So if you have any kind of change of status of income, things like that, you have to report, and then they do the recertifications each year.
Great. Thanks for checking on that.
So someone has insurance through a railroad and they got a letter stating that nothing would be covered related to autism. I would imagine that's not through, insurance in our state. So you might qualify for some Medicaid or, because your insurance isn't covering it. Would that be correct, Erin?
That is correct. Yeah. Yep. You should, if Medicaid can cover it, then you should be able to get coverage through Medicaid if your primary insurance won't cover it. Yep.
And then most, the primary insurances for the health laws that have changed quite a bit in Colorado, your insurance companies should cover it. I mean, pretty much most medical insurance companies now have to cover autism diagnosis, treatments, and evaluations.
Yeah, like I said, there is kind of a workaround. So for anybody who, definitely the big companies for sure have to cover it. But there has been a workaround with some, like if you are self-employed and you might have, gosh, I can't remember the name of the insurance program, but if you have kind of a buy-in insurance situation, there is a workaround with those guys that they don't have to. But if you have like Blue Cross Blue Shield, Aetna, United, any of those major ones, absolutely, it's included in there.
And someone he said, if your insurance company is quote self-funded, companies do not have to cover autism services in Colorado.
Yep.
That sounds like one of those workaround things.
Yep, but that's exactly what I was talking about. Yep, exactly. It's I found it with a few of my clients who've suffered that. It's annoying. So if you are self-employed, that's definitely a tricky area. So
Well,
Medicaid,
and it's not even you're self-employed, it's that your insurance is considered self-funded, which is different.
yep,
Yep. Okay.
yep. I know. Can we make insurance any more complicated?
Yes, those are
Another-
definitely those times to look into Medicaid and Medicaid buy-in programs, I think, for sure.
Yep.
Exactly.
Question, Carla says, do you have to recert biannually peak? Should send you paperwork or via your peak account? Was that an answer? I'm sorry.
Yes, she
sorry. Okay.
must have been answering to the buy-in program. It's through the Peak Medicaid kind of website, and they are the ones that will send out all that. They'll send you when you're due for your recertification, and so that you can, a lot of it now, you can do it electronically. So you can go on to your website, put in any kind of changes there and submit it, which is usually a lot easier and quicker than having to do everything through mail or having to go in. So yes, thank you so much for saying that.
Yeah.
I think we might have answered this, but I want to make sure I get everything in. If you qualify for Medicaid buy-in, does it become the child's primary insurance, or is it can it be secondary?
It can be secondary as well. Yep.
Okay.
Yep. Great question.
Hi, my name's Amy and I have a question.
Great. Hi, Amy.
Hi. I was just wondering, on the CES waiver, you said that parental education could be covered.
Mhm.
And I was just wondering, I mean, if, like for instance, like what would that entail? Like I've been looking at something called like the Sunrise program. I don't know if you've heard of them, but they do a lot of education for, people with autism. So I didn't know if that would be something that would be covered or what exactly is covered under that.
That's a great question. I don't know the Sunrise program, so I can't tell you exactly if that would be covered, but I would definitely bring that to your CCBs, your case managers, let them know about that. And it all depends, because everything broken down into the CES waiver is broken down to like how many funds for each section. So it
Okay.
depends on how expensive it is. If it's more than what they've allotted for that, then they might cover a portion of it and just have you pay out of pocket for the rest of it. But I would definitely bring it up to your case manager and see if that's something that they would cover. They're pretty vague. When I went through it, they're pretty vague in telling me like, these are the classes you can and cannot take. So I don't see why it wouldn't be covered if it's just education.
Okay, thank you.
Yeah,
Oh,
great question.
that's awesome. I've used a lot of their different educational benefits to do like where now most of it's online, but I used to be able to kind of go to conferences and everything where they would pay for the conference. I like to do a lot of Temple Grandin. If it is specific to the diagnosis, to the autism diagnosis, and you getting education based on that, then most of the time they will cover it. They won't cover if it's something that's out of state. They won't cover the travel, but they still may cover the program.
Mhm.
And like she said too, it depends on the funding and how expensive. And the only other thing that they won't cover though is if it is about education for whatever reason, like actual school based. If it's something that, so sometimes I've kind of wanted to look at stuff for going for IEPs and things like that, for whatever reason, if it's about education and that type of a system, they won't cover it.
Yeah, they're pretty specific. It has to be based on autism. Yep, absolutely. But yeah, like I said, I mean, they're pretty vague in telling you what you can and cannot take courses in. So I would just ask, you know, worst case scenario, they say, yeah, it's not covered, but definitely see if it is. That would be great.
Great, thank you guys.
Yeah, absolutely, Amy.
I don't see any new questions in the chat, but speak up if you have one last question. We have about 1 more minute here, so feel free.
One of our folks on Facebook had said when they had the question about do you have to be, what was the question? If you have to live here, what was that? I can't remember exactly the word.
Resident.
Yes. She said that they could be talking about immigration status. So do you have to be a US native? Do you know?
I don't know the answer to that. And I don't think so. Again, don't quote me on that. I don't think you have to be a US native in order to get that. I think if you are a permanent resident, you should be able to. So again, that's something I'd have to look into and confirm, unless anybody on this call knows for sure.
Okay. Or yeah, do you have to be like a permanent resident of the United States? Do you think?
Again, I don't think so. But again, I don't quote me on that. I definitely want to do some research before I tell you for sure. That's a great question.
My sense is if you're documented legally, you'll qualify for Medicaid.
Yeah.
Because we've had, as an agency, we've had people, the kids are on Medicaid, but the parents are undocumented, where it gets a little trickier. But that's like, you know, refugee and immigrant, that's probably talking with someone, but I'm pretty sure that they would qualify for Medicaid programs.
Yeah, thanks, Amy. And that's kind of my thought process too. So yeah, thank you.
Thank
Great.
you.
But I'm not alone in that one.
Thank you, Gail, for putting that specific stuff in the chat.
Well, excellent. Well, I just want to go ahead and share a link in the chat for a free consultation with me. You know, I'm here to help with any questions that you may have, anything that I can do to support you. I do understand how lonely this is and how overwhelming this whole process can be. So you definitely are not alone. Obviously, there's some amazing people on this call. So please just know that if you need anything, don't hesitate to reach out. So I've included that in the chat box. If you want to, go ahead and schedule that. It's free, no obligation. I just want to see how I can help you and offer you any guidance. But thank you everybody for being on this. I hope it was helpful. So it's a complicated system. It's overwhelming.
That's awesome.
you.
It's very helpful. Thank you. I'm going to just read really fast what they said in the chat for our Facebook folks who can't see this part. So what was posted about the question, can you get Medicare without being a US citizen? Specifically, this is the answer. Specifically, you will qualify for Medicare even if you are not a US citizen. If you qualify to receive or currently receive Social Security retirement benefits, railroad retirement benefits, or Social Security disability insurance. In any of these cases, you will qualify for premium Part A. And then who is eligible for Colorado Medicaid? To be eligible for Colorado Medicaid, you must be a resident of the state of Colorado, a US national citizen, permanent resident, or legal alien in need of health care insurance assistance whose financial situation would be characterized as low income or low income. So for our Facebook folks, thank you.
Thank you. And folks, we have at the Autism Community Store, call us about any of this stuff and we will try to get you in touch with Erin if we have her contact information, and we have contact information for lots of people who can help you get hooked up with the right information.
And oh, Allie Daniels would like to know how to get connected with your CCB. Allie, what county do you live in? Well, I can even, so after this, we can go ahead and still, oh, did she do that? Did we already answer that
She
one?
says Douglas County.
Douglas County. Okay. And Douglas, was that one already answered? And I was just up further.
Douglas is developmental pathways.
Okay, I think it was even
Developmental.
answered. So I'm so sorry. about that.
Google developmental pathways and call them.
Perfect.
All
Thank
right,
you,
thank you
guys.
guys.
Thank you
says
so much, Erin.
You can refer to it later on our website.
All right, I think we are going to sign off. I'm so happy that Erin, you are here to share all of that information. If anybody needs any more of her information, it should be, like they said, on here, or you can look us up on Facebook, and we have the recordings. So thank you so much. It was wonderful.
Thank you, everybody. Thanks for having me. Let me be part of it.
Thank you. Thank you so much.
Bye, everybody.